right now. I don't know if you want to just introduce yourself, Watley, real quick before we get started.
Can you hear me?
And we can hear you and we can
Yes,
see you.
yes.
There we go. All right.
I'm here. Thanks. Sorry for the technical difficulties. Yes, my name is Demetrius Watley. Been with Cure Violence Global for 12 years and part of the training team.
Great. Thank you. So as I was saying is this program was founded by a physician, by an epidemiologist named Dr. Sluckin, who worked at the World Health Organization for many years and then came back to the US in the mid to late 90s and really thought about him and other physicians thinking about violence from the lens of health and public health. And this is just, we kind of start some of these presentations with this charter, of the World Health Organization. And for us, it's impossible for communities and individuals to be healthy when there's these high levels of exposure to violence, right? And so that's kind of our jumping off point. And in fact, in many cities where we work, in many cities across the world, homicide is the leading cause of death, especially for younger people. And so this is what people are dying from. And so what Dr. Slikin did with other physicians is really to think about and understand violence from the health lens, to move away a bit from moralism and this idea of bad people, right? And to think about it in more scientific terms, and to think about it as a health problem and as a health solution. And as they were looking at this, and this is 20 some odd years ago, really kind of landed on the idea and understanding that violence is a contagion, meaning that it causes more of itself. And, although that was kind of a novel idea 20 years ago, we often hear now today, the epidemic of violence. When we say that, though, we actually kind of mean it, right? That we mean that it is an actual epidemic, that it is a contagious process, right? And that violence, in fact, behaves like a contagious disease. It's an epidemic. And more importantly, treating violence like an epidemic can get results in communities, right? And so often there's discussion about the epidemic of violence, but then we stop there and don't think about, okay, given that, what do we do? Like, what are some of the policies and practices that should be put in place to address it? So when we say violence is a contagion, like I said, meaning we mean it, right? So that there has population characteristics, there has clustering, there's various epidemic waves, and there's a mode of transmission, right? And so we can see here just very briefly in terms of the clustering effect. So we see on the left-hand side of the screen, we see cases of cholera in Bangladesh. And then right next to it, we see cases of violence, shootings and killings in Chicago, right? And so we see kind of this clustering effect, right? We know that violence has very kind of similar epidemic waves to the flu, to now I think recently we're all public health experts because of COVID, right? And so I think people are really kind of coming to understand a bit more this idea of health and epidemic and how things are spread and stop. But we see that violence follows very similar epidemic waves as other things like the flu, like cholera, where it's kind of nothing going on, and then a couple events will take place, and then we start to see some sharp increases, right? And the third point is that violence is transmitted through exposure, modeling, social learning, and norms. And so this is like particularly important for our approach and what our model does, right? And so if we understand that violence is transmitted through observing, through witnessing, through experiencing trauma, right? That it then shapes our brain circuits for how we then interact with the world and universe, right? And so this is a high-tech, smarter person than me drawing of kind of the brain circuits for copying. And this is true for all human behaviors, including violence, right? And so I think this is a really good representation, but I don't really understand it. I think this one kind of clarifies when we talk about the transmission, right? So we see the employer talking to the employee yelling, then the employee yelling at their significant other yelling at the kid, yelling at this poor cat, right? And so this is, I think, it's fundamental for us to understand this because it leads right into our approach and why our approach can be helpful to broader strategies to reduce violence. So when we think about violence, as a behavior, it's formed through modeling, trial and error, and then it's maintained through culture and social norms. And so what we see in this picture on the right-hand side is you see two adults with their hands clasped behind their backs, and then the young person, two or three following them, just following what the behavior is. And it's largely an unconscious process, right? And so it's like cute and all. But then we have kids same age, uh, growing up in an area where there's where there's a ton of violence going on, and they see kind of, again, mimicking some of the gang signs, the gunplay, etc. Right? And so we see this kind of copying thing that takes place. Again, these are children here in this picture, right? That covered with various tattoos, etc. Again, this idea of copying what people are seeing and what people are exposed to. And so in understanding violence, there's, a lot of methods of exposure to violence, right? So there's community violence, so either gangs, cliques, interpersonal violence, civil war, right? There's media, there's family, there's school violence, there's state sanctioned violence, so institutional violence, police violence, right? And all of these things can infect somebody, right? And people are susceptible, and there are different protective factors and a lot of other things that go into it. But essentially, when people are exposed to violence, they then become more likely to be violent themselves and perpetuate other violent events, which leads to additional victimization. And so what we see in many areas where violence is acute, where there's a lot of violence, is you see multiple exposures that lead to multiple events, that leads to multiple exposures, that lead to multiple events. And so it's kind of this cycle of violence going on at a community level, right? And sometimes it's larger in the community level, sometimes it's a city level, sometimes it can almost be a country level, right? But this idea of multiple exposures leading to multiple events. And so one event leads to another, leads to another, leads to another, and then we kind of land where we are in many places. And so for us at Cure Violence, we understand that there are many social determinants of health, and there are large contextual and structural issues that contribute to the context of how and where violence is taking place. And from our perspective, we think all of those issues need to be addressed. They need to be thought through. There's a ton of groups and organizations doing that, and we, think that that's great and support that. What our model specifically is to address shootings and killings today at a community level. And so we know that there's a lot of other complex things going on. And so we would never say that this is Cure Violence Global is like the solution to all of that, because it's not, right? We have a very specific role in terms of how the model can be helpful to a city or a community dealing with violence. And so the one thing that's particular about violence, if you think about education, economic, healthcare systems, built environments, resources, the violence can affect it. It in fact causes more of itself, and then can also affect a lot of the other ones, like very specifically, very immediately, today. And so it's not like the long-term issue. I mean, when kids can't go to school because they're afraid to walk to school, or they're having multiple exposures, to an already failing school system, their performance obviously gets diminished, et cetera. And so it's the same thing for a lot of the social determinants of health, that violence has a very particular role in it. And what we see our job and our kind of lane, if you will, is trying to address some of the day-to-day violence today, right? And so in understanding, though, violence as an epidemic from a health lens, I mean, this is in fact good news. Why is it good news? It's good news because we know how to stop epidemics. Not that it's easy, not that it's not super complicated. I mean, as we can all see with the recent example of COVID, how complicated some of this gets, and how narratives and counter narratives and issues of class and race all, factor into these things, right? And and in fact can exacerbate it. But fundamentally, we know what to do to stop epidemics, right? And it's three things: it's interrupt the transmission, prevent future spread, and then change group norms, right? And so we do this for any epidemic, right? And so given this understanding, given these three things, that's how we built out the cure violence model, right? And so it's really kind of three components of it that we're going to talk about. But on the one end is interrupting the transmission. So these are a category of workers we have called interrupters that Watley's going to talk about in a minute. But basically their job is to mediate conflicts at the neighborhood level, keep situations cool, try and prevent retaliations. The second part of preventing future spread is really working with the highest risk. When we say highest risk, we mean highest risk to shoot someone or be shot today, tomorrow, this week, like that. This is the highest risk that we're talking about. And so working with them, meeting them where they're at, trying to work to change behaviors, trying to help provide treatment or resources when requested. But the idea that's kind of more of the long-term work with the highest risk, right? Of really reducing some of the risk factors that can lead them to either shoot someone or be shot, like in the immediate future, right? And then the third part is really changing community norms, right? And we do that by doing shooting responses, organizing community, and spreading positive norms. And so this is the basic model that we use in conjunction with either cities, different community groups as part of their broader strategy to reduce violence. But this is a very specific kind of lane in which we operate. And so, like I said, the first part of the model, which is interrupted transmission, we have a category of violence interrupters. And so I'd like Watley to maybe just talk for a minute or two about what a violence interrupter is, who they are, and what their job is.
Sure. So a violence interrupter is a man or a woman that is credible, a credible messenger, a person that have relationships, that is respected in the community that they'll be servicing in. These violence interrupters actually come from their community. That's very critical for their role that they'll be playing. And one of the things they do is they know the key individuals, they know the high risk individuals. They already have some level of influence in the community. And what they do is they're there to mediate conflicts, stop things before they jump off. If something jump off, to immediately prevent a retaliation, and to constantly build those relationships with the high-risk individuals within the community that they'll be serviced. But they have to be from that community where the program is being implemented at. And they must be very respected and have those great relationships, not only with the high risk, but with other key players in the community that knows what everything that's going on in the community. So they have that credibility to build those relationships, to step in and to stop people from getting shot or a fight from breaking off or a retaliatory shooting.
And thank you. And the reason that this is important in terms of having the staff be trusted and from the community is like, that's the prerequisite for doing any kind of meaningful behavior change with the highest risk. Like the messenger has to be trusted, right? And so we know about, we talked about how behaviors are formed and maintained, and the way that they're changed, right, is by getting new information and new skills by someone who you trust, right? And that's why this model is really designed to deal with the highest risk, and is why we employ, or why the cities employ who they employ to do this, is because of that credibility, because that level of trust is the way to change behavior. Oftentimes we think about, punishment and these things, and really that's not a determining factor in how people decide what they're going to do. I mean, a lot of it has to do with pure expectations. It has to do with, really getting the right information from people that you trust is what makes the difference in terms of making some of those changes. So this is how this links back to kind of the things that I was talking about before. And as Watley said, credible messengers. And for us, the program has operated in many different countries and many different contexts, but it's always been the same in that if it's in South Africa or Puerto Rico or Inglewood or Trinidad, the workers are always credible to the highest risk in the community that they're working in. So the second part of the model is changing behaviors, right? This kind of more long-term preventing future spread. And we have a second category of worker called outreach workers. So Watley, want to kind of talk about what the outreach workers do?
Yes, and outreach workers, just like the violence interrupters, they must be credible as well. And what we mean by credible, a credible message could be a football coach, could be a barber, could be a person that came home from prison, want to change their life around, anyone that's credible in the community. Now, one of the differences between an outreach worker and a violence interrupter is that the outreach worker deal with the participants on a longer term, anywhere from 6 months to 18 months. And what we do with the participants, once they agree to join the program, we create a risk reduction plan with the participants. And with this risk reduction plan, it allows the participant to tell the outreach worker the things they would like to achieve while in the program. And it could be things from getting an ID, going back to school, maybe getting a job, or substance abuse, whatever the thing may be, is created by the participant. And the outreach job is to help the participant make it from step 1, step 2, step 3, step 4 in the process. And at the same time, they're also reiterating about nonviolent situations, how to mediate conflicts, and how to deal with situations as they occur. They're always trying to change the behavior of the participant every time they meet. They meet with the participant 6 to 8 times a month. And to follow up on this risk reduction plan, teaching them new skill sets, teaching them how to avoid conflicts and things like that. And they build a relationship over a period of time. So the hopes is when the participants start the program at a high level, the hopes is getting from high to medium to low. And they're usually taking anywhere from 6 to 18 months, depending on the participant.
Thank you. And then the third component is this kind of norm change work. And so Watley, you want to talk just a little bit about the norm change component of the model?
Yes, and the norm change is very important because it's critical to have the community involvement. We must have the community involvement. And one of the ways we do get the community involvement is through when there's a shooting occurred in the community. We galvanize the community. We march through the area where the shooting took place at, let the community know that this is not normal, shooters is not acceptable. We always want to get the community to buy in. Once we get the community to buy in, we know from experience, I know for sure that things happen on the block, the community members will usually call cure violence before they call the police, because we're able to respond a little quicker. We have those relationships with those men and women that's already in our neighborhood. We also have those community events. We bring the community around and we just explain to them the program, what we're doing in the community, what is our intentions in the community, what we need for them to do in the community to be supportive for the work that we're doing. And we pass out public aid information, just giving them information about the program and what do we be doing and how long, where our office is located, and everybody that's working on the program.
Thank you. And here's another example of a shooting response. I mean, sometimes they're smaller and they have kind of the tenor of like a more vigil type thing. Here's some of the public education. I don't know, Watley, you want to talk a little bit about how you all have used PubEd?
Yes, we use PubEd as a talking point to engage the community, to let them know what it is that we do. There's different forms of PubEd depending on the target that we are targeting, and it's good talking points. And we use this PubEd everywhere we go, just to pass out to the community, store owners, business fronts, even to the participants, just to let them know this is what we're doing. This is what we're trying to do. We're trying to stop the shootings and killings. That's our main goal, is to stop the shootings on the front end. We try to prevent shootings before they happen. And we try to stop retaliations just in case a shooting has occurred.
Mm-hmm. Thanks. And so the way that these three components kind of link together, right, is so at first we have the interrupters that are finding out about conflicts and trying to mediate the immediate back and forth, right? That's why they're called interrupters, or prevent retaliation. Then when working with the highest risk and the highest risk situations, we find individuals who are participants, right? And we kind of work more long-term with them to try and, work on really shifting some behaviors and some of the norms, but it's kind of the long-term work with them. And then by doing that, we're working with the community, right? That the areas that they work and live in and hang out in, to do events and have public education materials that kind of reinforce stuff that was started by the interrupters, right? And so it's all kind of linked together. And so it's not just, meeting a couple participants here and there or having an event. It's all linked back to the shootings and killings. And that's how the model is kind of applied. And I think that the critical aspect of this is that from our perspective is like the community is the main central actor of this initiative. And that's really the way that other epidemics are managed. But the way that this becomes implemented, which we'll talk about in a minute, is in many instances, a city government, like a health department or a mayor's office of criminal justice, or sometimes UNICEF, whatever it might be, there's a kind of an overall agency that funds this work. They then subcontract with community-based organizations who actually hire the staff and do this work as part of something that they've already been doing, or it's kind of a new component to kind of their area of work, right? And so this is a critical thing. And so it's really the the main actors in this work is the community themselves, community-based partners, and individuals who have this credibility, right, with the highest risk. Many of them been involved in some of the violence before, and so this is kind of the critical, I think, lens in which the model sees it, but then also is implemented through this way. And I think what this asks us to do, and what we ask to do, is to really re-understand violence and getting away from this idea of moralism, bad people, that need to be punished, bad choices, right? And then think more about some of the circumstances, think about the means of transmission, thinking about this though from a scientific perspective. And if we understand that, then seeing the need for credible messengers to serve as interrupters to really get in and be able to change some of the thinking and behaviors of those that are most likely to be involved in violence, right, in a supportive way. These are some of the cities that we've worked in or are working in or expanding in. And again, every time that we work with a city, it's locally owned, locally funded, locally implemented. Our job is to help set it up and provide ongoing training and technical assistance. But if there's a site opening in Des Moines, it's part of the city of Des Moines. The local partner is the one who does the implementation, and the staff are all recruited from Des Moines, Iowa. So it's not like sending people from New York to go work in Memphis or anything like that. These are the countries that we work or have worked in. And for every place we work, it looks a little bit different, but we're constantly doing those three main components of the model. So in Southern Iraq, it looked different because what we were addressing was tribal / militia / community violence. And so our workers there had a different profile than they did in Baltimore, but it was still doing the same thing, using that credibility to interrupt, to prevent future spread, and change group and community norms, right? And so it's always the same activity. It might look a little bit different. So when we first started in Chicago, what we saw, and so I'm going to get into just a little bit of some of the results stuff. What we first saw is the areas that was implementing the program, which was called Ceasefire at the time, saw greater reduction than comparison areas neighboring or Chicago as a whole. We again saw that in 2005. And that's when this approach kind of garnered some attention. And there's been now in the past, I don't know, I've been here for the past 18 years, kind of this growth of and learning of this model. And there's been implemented in different cities, like I just demonstrated, but there's also been a number of independent evaluations. And so I'm just going to go over some of the key findings of some of them. So in Chicago, an evaluation was done by Northwestern, funded by the Department of Justice. But one of the things that they saw that this model can contribute to is this idea of cooling down hotspots, right? Of making there be less exposure to violence, right? And so if we think back to the beginning of the conversation, as like the more exposure there is, the more likely that there is to be violence, right? And so if we can cool down some of the hotspots, like we've been able to show in Chicago, it's what's important about this is it's not just like pushing it off to somewhere else, right? It's not like just setting up a camera and then so everyone just walks 2 blocks the next way. It's really about engaging those who are involved in violence in a meaningful way. And so that's how we can see this kind of cooling down effect. And so we saw that kind of multiple times in Chicago, where it was able to cool down exposure in terms of shootings per square mile. Some of the other things that we saw in Chicago was, shootings went down, hotspots went down, and then this idea of retaliation, reciprocal murders. I mean, this is, I think, where the model can be effective in terms of understanding how a lot of the dynamics is one shooting leads to another, leads to another, leads to another. And so we're able to kind of step in and prevent that retaliation. You can really see the numbers start to go down in terms of people being shot or killed, and then broader the issue of exposure at a community level. In Baltimore, the program's called Safe Streets. It's been evaluated a couple times by Johns Hopkins, and they found kind of similar results in that they've been able to see the communities reduce shootings and killings, around 40%. Some of the neighborhoods in Baltimore were able to go a year more without a homicide. And so, again, I think this is another kind of example of the city, the health department kind of had it. Local community-based partners were funded to do this, and they were able to see results at a community level. In New York, John Jay College, a year or two ago, or maybe 3, did an evaluation of the program there. And again, we saw kind of similar results in terms of gun injuries going down, shooting victimization going down in the areas we were working. You can kind of see in this slide, compared to comparison areas, that we saw kind of greater reductions in the areas where the program was funded and implemented. One of the other findings of the evaluation in New York was that confidence in the police was found to improve at a higher rate in the areas where the Cure Violence program was. This was not an objective of the program nor like a stated goal, but I think what's interesting about it is because we're a community-based program, we're not a law enforcement-based program, so we don't like share information or anything like that. But I think when you're able to, the way that the workers work is, so say someone gets into it at the club, right, at 3 a.m, Sunday morning, right? The workers find out about it. They're able to follow up in a way to kind of get in front of it before it has to lead to a shooting or killing, right? And so that if you really have the right workers, have the right relationships, we're getting on top of these conflicts that can quickly spiral out of control much quicker, and it provides a kind of different space for other institutions to operate. So if we can be on top of some of this violence, if we can be on top of some of this back and forth, I think it allows space for other things to take place in terms, and so I think this is like a critical aspect of how this model is like kind of complementary to other approaches that the city might be using or a community might be using, because we're really focused on those back and forth shootings and killings. There's been evaluation work done in Trinidad. We had a program in East Port of Spain. And again, we saw kind of reduction of call for services. We saw reduction of shootings and killings. Just as an example here, you can kind of see when the program starts, we kind of see this big drop off of shootings and killings in the area, and it's kind of maintained throughout. This is another kind of example of that, where there wasn't able to do a randomized control study, so they had to kind of develop a synthetic control area to really look at it. People much smarter than me would understand this. It's all on it's on the website to check out, but essentially showing that our areas saw a greater reduction than would be expected, right? Or that would be expected from other areas because the workers were there during the work. The most recent evaluation was on our program in Cali in Colombia, and this was released in December. Essentially, we were in 2 areas. We saw reductions in homicides and we saw reductions in retaliatory homicides within 7 days. And so I would just say in Cali, Colombia, it was at the time one of the more violent cities in Colombia, and these were 2 of the most violent neighborhoods in that city. And so what we were able to demonstrate in a context very different than the US, by doing the same set of activities, we are able to see an impact. And so now there's a lot of discussion about hopefully expanding the work in Colombia now that it's kind of been proven there. These are some of the other kind of successes that we've seen in other places. And again, all this is on our website. It's been highlighted in the New York Times and kind of other media sources, and all this is on our website. But I think, in thinking about how to start this program in a new city or a new community, there's a thing we call the assessment process. And it's not, assessment's not really the right word, but it's this engagement with a city or a community to answer the following questions, right? We're trying to figure out, like, is there a governmental or non-governmental agency with the capacity and will to do this model, right? The political will, the resource will to do this, like, does that exist or not, right? And how does that look? Is there official or unofficial data about the violent incidents so we can like focus, monitor, and measure the implementation? Is there some data about the nature of violent incidents to see if the model is appropriate? And I say that because, this model is very much, our experience has been at community-based violence, linked sometimes to some cartel, to other stuff, but if the violence is all, like, for example, intimate partner violence or all domestic violence, that it's not taking place in like kind of a public sphere, the model is not fully adaptable to totally cover that, right? And so we want to understand, like, is what the violence that's going on in this specific neighborhood, does it make sense for this model to be employed, and do we think it can be helpful? So we try to figure that out as part of the assessment process. Are we able to create the criteria for the highest risk population? So in the US, I mean, the answer to this is usually yes, because it's very similar, but in other countries, that's not the same. Then we look, like I mentioned before, like, are there community organizations that exist that could serve as the partners to implement the program? And so there's, a series of criteria with that, but it's essentially about connection to the community, being willing to do this type of approach, being willing to hire individuals that are interrupters and outreach workers, and being open to working with the highest risk, right? And then trying to figure out, like, do individuals exist to be violence interrupters and outreach workers, and what could a recruitment strategy look like? And then we try and land on, what would so say we're talking about, like, I don't know, Memphis, Tennessee, right? Like, going through these processes, okay, these would be the 3 or 4 areas. This is a staffing pattern that might make sense. Here's what, we think the budget potentially could be to cover this, so that you could, realistically anticipate results. And that's where it kind of lands, so that a city or community has kind of a plan then forward of, these are the areas, this is the staffing pattern we would need, here's how much it would cost, and here would be our recruitment strategy to get started. So it's like almost like a playbook is where we kind of land once we finish the assessment. And the phases of the assessment, the way that it usually goes is, once a city or community is interested in doing this, and we have a relationship established, we have the first phase of just kind of giving 101 presentations, right? Like, so we can just explain the model, what it is, so everyone understands it, kind of, answer questions, deal with whatever some of the local dynamics are. But then phase 2, having kind of more key stakeholder meetings, so smaller groups, so we can start to answer some of those questions and really strategically plan with the stakeholders, like, how would this look here? Phase 3, in person, COVID permitting, visiting the stakeholders, the community groups, and potential workers in the neighborhoods at night, where the program would be, so we can really get a sense of, like, some of the dynamics and what type of recommendations we could make in terms of staffing patterns, right? And specific recruitment strategies for that community, and specific kind of feedback on the groups that we met with, and which ones, could serve as examples, and which ones you might want to invite to do the model. And then phase 4 is kind of like I said, there's a report with the budget, the plan, and so that if a city or community decides they want to do this, they would have kind of a playbook of how to go forward. So that's a very, kind of brief presentation of what the model is. We wanted to allow at least 20 minutes or so for Q&A, but we just kind of went over some of the ideas behind it, what the model looks like, some of the results we've had, and then what an assessment, kind of what a get started of the model in a city looks like. So I think we can take some of the questions in the chat box, and then I'll let you.
Brent,
So do you want to facilitate this part?
Sure, yeah. So I saw a few questions first come in from Jonathan, so I can allow you to speak if you would like to elaborate on those.
Hey, good morning. Thank you all for making this presentation. I had a couple of questions. I'm here in Denver, Colorado, and been doing direct services via either being an outreach worker, violence interrupter, and now working as a kind of a program manager here in Denver. There's a couple of trends that we've seen over the last few years, and I'm just wondering, how can the cure violence model be applied to like some of the changes in the historical ways that young people and youth violence is operated, one being social media driving a lot of the violence, and those conflicts. How do you get in front of those and start to interrupt those, and before they evolve or devolve into real life violence? And then the other piece of that, which is right aligned with that, is like we're seeing a shift from the traditional gang model, like that hierarchy where you can talk to shot callers and people who are influencers within a particular gang, to these smaller groups, which are, they may only start off as 5 or 6 of a clique, but they're really violent, and they're motivated to use gunfire to try to prove a point, and often market themselves on social media. So those are my questions there.
Great. Watley, you want to?
Sure. So with the first question, with the social media conflicts. So once the violence interrupters and outreach workers are selected, we go through a 40-hour training. And that's part of our training with social media. All of our VIs and outreach workers, they are friends, and they follow these people on social media, the high-risk individuals in the community, their participants, key individuals, everybody that says key players in the community, they follow them on social media. Even with me, when I was a VI, they used to call me the inbox king, because I stay in their inboxes, addressing issues that they might put up a stat or something. I immediately go to their inbox and ask them, please take that down, because this might lead to this and this might lead to that. And when you have those credible messages, those who have those relationships, they're able to reach out to these young men and women once they do post them on social media. And also, these things with these cliques, they spread throughout. It's happening everywhere, Chicago, everywhere. And what we do is that we have those credible messages that's able to reach these certain individuals. So when we come into a city, we don't have sites throughout the whole city. So whichever data tells us that the gun violence and community violence is high in this particular area, that's the particular area that we start in. And we hire those individuals from those particular areas. If it's somebody from group A, group B, group C, we at least try to find violence interrupters from those particular groups. So that way we got somebody that can reach out to all the groups that's within that community, that is a part of the problem within the community.
All right, can I do a quick follow-up on that?
Sure.
So I hear what you're saying. My concern is, like, with some of these newer groups, just from my observation, I don't know if they're even established enough to.
Right.
Okay, I'll put it this way: a lot of the new groups are not really established, and so to recruit a credible messenger from that group, that person is going to be viewed as maybe not credible, simply because he's preaching a different message. The other piece of that is, a lot of these younger groups, they don't respect the OGs, so to speak, or the ones that would be seen as credible messengers, because they view themselves as dealing with a completely different set of circumstances and environments, and say even the 30-year-olds right now, like the 20-year-olds are looking at the older ones like, man, get out of here with that.
Mm-hmm.
So it's like, how do we recruit or establish that credibility and that influence in the ones who would be the credible messengers, I guess, is my question.
Yeah. Yeah. I mean, I think what you're seeing is very is in line with a lot of other places, right? And so I think when we try and recruit people, it's a mix of things, right? It's like recruiting younger people too to serve as interrupters and outreach workers, because you're right. Like, I mean, some people have not been cool like since the 90s, right? And so it's, what I mean? So that, so there is this kind of attachment. So we try and think about recruiting younger people. And in terms of it, it's often not, we're not able to recruit from every single small little clique, right? Obviously, because sometimes it's just 3 people, right? But getting people that have like a neighborhood or a couple block radius good relationships, right? So they could then build on it, or maybe their cousins know that, you know what I mean? That there's some level of connection to even the youngest individuals, the youngest groups, either through family ties, personal ties. But yeah, and so it's not easy. So nothing we're talking about like is easy at all to do. And I think it just thinks about like, we have to think about specifically those areas. And so the community that you're talking about, I don't know which one where it is, but it would have to be that micro analysis. Okay, who are the crews there? Who are the groups there? Okay, who are some of their older brothers? Do we know any of their older cousins? You know what I mean? So it kind of goes back from there to be able to reach them. But you're right. I mean,
That makes sense. Yeah.
yeah, I mean, young people don't think old people are cool ever, and they shouldn't. You know what I mean? So, I mean, I think that's like part of it. So thank you. We can take the next question. I know there's a lot.
Okay, yeah, so there's one from Mark, so I will unmute him if he would like to ask it. Mark, you should be able to go off mute. Yeah.
Yeah, I was just curious about how your organization is funded and what would be some of the estimated startup costs, particularly for a smaller community.
So, most answers I'm going to give today, I apologize. It's like, well, it depends, right? So every city is kind of different. And so a lot of cities are funded either through a mayor's budget or a city council's budget or like a city manager's budget, right? And so it's usually locally funded. The price to implement the program in a community ranges from anything between $250,000 a year to a place like New York, where it's like close to $1 million a year per community. And so it just kind of depends on what locally is available. For us, the smaller programs in the smaller communities usually ends up being, 3 to 4 interrupters, 2 to 3 outreach workers, some money for events, public education material, staff support, and so it's largely the budget is for staff and staff time. And the thing that we have to figure out with the assessment is like, what is the coverage going to be and how big of an area can we cover that we can anticipate results. And so that's kind of the ballpark. It's like per community, anywhere from like 250 to $1 million. I know that's not a great answer, but like, you know what I mean? It just kind of depends on the dynamics in terms of population size, the number of violent incidents that are taking place, and then the dynamic of it, right? And so what the person before you was talking about is like kind of the smaller clique, smaller group stuff, not a lot of hierarchy going on. And so then the question would be, if I'm working with this one small clique here, are they going to be still work with me if they know I'm working with someone else who they might be against? And so, you know what I mean? So there's just like certain dynamics to try and figure out in terms of what an appropriate staffing pattern would be. I'd say most of them are in the 350 to 450 range. Some are smaller and then some are a lot bigger.
So to start, I guess to find the person that's going to head the program, would that be somebody that you guys would employ and provide?
No, yeah, okay, I'm sorry. Maybe I didn't fully answer your question. And then to work with us, so we have like an assessment, like to do the assessment work, right? With us is like, I think about $10,000 or something like that. I mean, if that's what you're asking specifically, and that kind of goes through the questions that we kind of answered to try and help figure all this stuff out. Sometimes though, a city might not be ready to do that. And it is about figuring out like who is going to be the point person. And so sometimes we work with cities kind of before the assessment, just to think like, okay, it makes sense to have this position, like in the mayor's office of criminal justice. This person's portfolio already has kind of violence prevention. Let's work with them to try and build this out. Or, you know what I mean? And so it varies from kind of city to city, depending on what locally is going on.
Okay. And do you have any areas that are partnering with other cities? For example, we're a small town, but we're near Columbus, Georgia, which is, I think, in the process of implementing the assessment part of it now. So,
Yeah,
would it be something where you could partner with a larger city?
Yeah, I mean, so like, for example, in North Carolina, right? So there's been, we've worked in Durham. We did an assessment in Charlotte. We've worked in Greensboro. and there's a couple other cities that are interested. And so there's definitely been like learning exchanges, and there's been kind of collaborations to think about the pre-implementation work. I would say though, to do the assessment work, like for example, Savannah, Georgia, Watley and I were on a call with them earlier this morning before we joined you all. They're still in that kind of the assessment phase. So I think there could definitely be information sharing, something like that. But like to do that specific design stuff, it usually is best to work with us so that you get the, you get the full scope and scale of everything. But definitely, I mean, reaching out to other cities that have done it, have a good experiences, bad experiences, and whatever. I think that's a good place to start in terms of starting to think about internally, how would we organize to then do some assessment work? I hope I'm answering your question.
You are. That's pretty much what I needed. Thank you.
Okay. Okay, next question.
Yeah, so I think the next question will be from Lonnie. So Lonnie, I'm going to take you off mute if you would like to ask your questions. Lonnie, are you able to unmute yourself?
Yeah, sorry. I think my question was basically the same. What does it cost for an assessment? And so I think Brent answered my question.
All right, then we'll move on to the next question, which I think is from Jason. So I'm going to take Jason off of mute if you would also like to speak.
Yeah, I think you answered. My question was about the cost for the assessment, but you answered it in the process of your response to the previous question.
I'm going to put that on the slide next time too, so people can just have it right away.
Thanks, appreciate it.
Yeah, for sure.
Then the next question I see is from Amani, so I will take her.
Peace, everyone. My question is about the housing within the mayor's office. Does it have to be, like, that primary position have to be housed there if there's a lack of trust with the affected community and city officials and the police?
No, it doesn't have to be that. It's been iterated in various forms, across the country and across the globe. And so, like, for example, some places it's been in a county health department. I mean, so the reason I think that some of the local governments have, are successful in being like the oversight is that like constant stream of resources, because I think that's the issue. But other cities have done it in different ways, or other communities have done it in different ways, or have gone through non-governmental agencies as well. It just kind of depends on what locally is available and what people want to do.
Okay, thank you.
Mm-hmm.
Don't see other immediate questions, but also if people want to raise their hand, they can do that as well to ask any more questions that they may have.
This is Amani again. Will we have access to this recording?
I don't know. Will we? I'm not recording.
I'm recording this. So
Yeah.
Brent, if you're okay with that, I can share it with everyone who's attended.
Sure. We can definitely share something.
Great, thank you.
I think I saw a hand raised from Beverly. Oh, nope. Sorry about that. All right, Beverly, you should be able to speak.
Sorry. Okay. Hi, I'm Beverly. I'm from Denver area with Jonathan, probably some other people on the call. And I had a question really about the third component and the social norming and the ways that you connect with the whole community.
Yeah.
And I'm wondering if you ever, like in Denver, we're looking at having this social media campaign. We already started it at one of our projects called the Power of One. Mm-hmm. And so it would be like, I'm just wondering if you connect with like broader messaging like that and how that works. And then that was one part of my question. And then the second part is, I saw in the slides you showed how you connected to, after a shooting occurred, you brought people together. And I think that seems really important. I'm just wondering how that stays ongoing, do you then partner with maybe other community organizations to help the community heal? Those are the questions I have. Yeah, see what you have to say. Thanks.
Yeah, no, I mean, Ron, so in terms of again, it just kind of depends locally what's going on in terms of some of the broader messages. And so some cities have had this be kind of wrapped into larger social marketing like campaigns, right? Like in Cali, for example, they had a whole kind of like healthy well-being kind of campaign that had different programs and resources, and this was kind of linked as part of it. Other people have had their pub ed be part of a larger pub ed thing. So it just, I mean, I think for us, the model that we're talking about is a very specific piece of it, and then how it fits in to either a community or a city, or what I mean, is very locally driven, and it is guided by what makes sense locally. Because we're not Cure Violence Global are not like, we're not like a government, intergovernmental agency like expertise. I mean, we're really about one component of the model. And I think what tends to happen is communities and community-based organizations who take this on already have a high level of skill and ideas and thinking about it. And it kind of can fit in very well and very naturally with what else is going on. And so from our perspective, the combinations and the possibilities are really like limitless. It just kind of depends on what's going on locally. I think for us though, I think the thing that we always kind of maintain is like our role is really with the highest risk and working with the highest risk, and then partnering with everybody the best we can, you know what I mean, to do everything else. And so I think there's a lot of possibility with that. In terms of like the shooting responses stuff and the healing, again, a lot of the cities and community groups like will work with other partners, other agencies, to do peace circles. I mean, I think there is a lot of open space for it to be kind of defined locally, but you know what I mean, of like how best to do that. Because you're right, going on a march, every week about shooting and killing, like is not, you know what I mean, it can be exhausting, right? And so some of the community partners that think of different ways to do it, engage other partners to take the lead on some of it, and to enlist volunteers, because a lot of times people want to help or want to volunteer on something like this, and it's like if I'm just like just a normal whatever that means from the community resident, right? I might not have the relationship, so I can't volunteer and be an interrupter, right? But I could volunteer to either come to an event or come to a shooting response, and so it really kind of depends on what's going locally. And there's been a lot of different examples. So I mean, I know that's not a great answer, but that's kind of like the possibilities are really determined locally on some of that stuff.
Yeah, that's really helpful. Just to follow up, is there also have you had any evaluation with communities that have done those multiple components to see how that impacts?
Yeah, I mean, I think the John Jay stuff looks at some of that stuff, I think, but largely the evaluation has been done very specifically on kind of looking at, there's been some community survey work about just like perceptions of like safety, right? Perceptions about, so I think although we've been around for a minute, I think the body of research is still relatively young. If that makes any sense, I mean, there's a lot of space to grow some of those things, and there's probably a lot of things that aren't captured or documented properly. But I just think about like in Honduras, for example, like so we work with UNICEF there, and we're part of like their broader just like overall engagement. And when the tropical storms or hurricanes just happened, the interrupters and the work there converted right away to kind of emergency response. And we're working with like all sorts of different things in terms of like mass distribution of getting people to safety, you know what I mean? And so kind of like, because the workers were so just enmeshed in the day-to-day operations of the community, they kind of took on a lot of different roles and partnered very seriously with a lot of different agencies to do other things. And so, I think that's just like one example recently, but I think that's ongoing in many of the cities that people are doing the program, like it manifests itself in different ways depending on what's going on. But I don't think there's been a lot of research or written up about that particular component, which is like super important.
Okay, well, that's work to do. Thank
Yeah.
you so much. That's
Please
really
go for it.
yeah, I guess I'll just comment. It also takes a long time to build the model, figure.
I'm sorry, you cut out right there. I didn't hear the last thing you said.
It also takes a lot to build the kind of model that you have. You know, I'm sure it's taken 20 years to get to the level of where you know how to replicate it. You know the core components that need to be there and how to train on that. So,
Yep.
Anyway, thanks so much.
Mm-hmm.
We have another question from Trina. So I'll allow that.
Hey guys, I just have a question from down here in Miami, Florida. Are you guys working with anyone currently in Miami, or are there any initiatives that are planned to take place?
Not currently, no. The
No.
closest we are to you is in Jacksonville.
Okay, which program are you working with in Jacksonville?
So we are where it's called, is it called Cure the Streets there, or Bridges to the Cure? So there's a program with the mayor's office, but there's two community-based partners. One's called Noah's Ark Foundation, and the other one's called Bridges to the Cure.
Okay. Okay, thanks so much. Just
Yeah, that's
wanting to
close
know
we get to
before.
Miami currently, yeah.
Got it.
All right. And then it looks like there's another question from Lonnie, but I can also bring on.
Hi, yeah, I was kind of thinking forward about this. If we were to adopt it, I'd be interested in hearing about what sorts of evaluations and data resources you guys offer. I believe there's a Cure Violence global database that maybe you've built that I've seen mentioned in other evaluations. And I was wondering if you could talk a little bit about that and some of the challenges and benefits that surround collecting data around evaluation of the violence interruption efforts in particular.
Yeah. So we I probably should have mentioned this right but we have a database that we've kind of designed over the years. It's that the current platform is on ComCare. And it's a database that it captures most of our inputs, right? So the work that the interrupters and outreach workers do on their daily basis, like kind of the number of people they're seeing, what type of activities they're doing. It captures information about the conflicts that they're finding out about, and the media, and what kind of mediations they're doing, what type of strategies they're using, and the follow-up. And then we also have data that kind of looks at the work with the participants that Watley kind of described. And then there's some kind of broader data points in terms of just like community events and things of that nature. And so a lot of the sites find it to be very helpful in terms of their day-to-day management, and really kind of thinking through strategically and using the data to kind of inform some of that. We're now in the year 2021 getting better at using Tableau and things, of being able to provide kind of data visualizations to the sites and working with them so they kind of have this. And so we use that, and then we also look at official data in terms of you know, the area that the site might be working in versus comparison areas versus city or like county as a whole. And so every place is a little bit different. So that's a database we use. In the database, though, I should mention, we don't use anyone's like names or specific addresses or birth dates, just in terms of like privacy and making sure that we would never capture anything that could kind of put someone out there. And so we want to make sure that the data is like, tells the story, it demonstrates what we did, but doesn't capture like, you know, anyone's like birth date or social security number, particularly given, you know, the kind of the topics in which we're engaging people on, which is, you know, shootings and killings and retaliations and things of that nature. So I hope that answered your question, Lonnie.
Yeah, that's great. Thank you.
Yep.
I don't see any other questions, but if anyone has anything last minute, I think Mark would like to maybe talk with you, Brent, maybe offline about next steps.
Sure.
But does anyone else have any specific questions right now? Oh, I see another one from Lonnie. All right.
Yeah, I just wanted to know next steps or what we should do from this point.
Yeah, I mean, so if there's interested, I think you can follow up with the email, whoever you emailed to correspond to get to here, and then we could set up a more individualized conversation. That makes
Okay.
sense. Like, yeah, we
Mhm.
could set up like a follow-up conversation specifically about kind of what you all were thinking and next steps on that.
Okay, thanks.